And this is in another one of our top stories. We've been tracking this for quite a number of weeks now. South Africa finally resuming its vaccine rollout with the Johnson & Johnson jab. This after it had been suspended over fears of a possible link between the vaccine and blood clots. It had been put on hold after 6 people in the United States developed blood clots after inoculation, prompting the US government to briefly suspend its use. The health ministry here has now said that there is 1 in a million chance of getting the clot after the vaccine, and that it appears that women between the ages of 18 and 48 years old are particularly at risk. And with such a low probability of developing a clot, all regulators have recommended the use of Johnson & Johnson. Professor Glenda Gray, the president of the South African Medical Research Council, now joins me live. Prof, a very good evening to you. Thanks indeed for your time. So phase 2 of the rollout expected to commence on about the 17th of next month. Do we know how many people over 60 have already registered on the online portal?
So the last time I checked, there was quite a lot. It was more than 350,000 people, which was very good. And this was about a week ago. So we expect, as there's more news going around, that more people will register. Obviously, the people are registering and talking to their service providers and their medical aides, and so we can expect a lot of other people will be registering through their programs that have been established through other public-private partnerships.
The second phase, touted to be complete by November, is that still a realistic deadline?
Well, I think so. I think we can only test our metal once we start to roll out the program. Mm-hmm. And so what we've been doing is we've got a lot of practice through the Sisonke study. Yeah. And now that we will transition to a full rollout, I can expect there will be some challenges and some hurdles to overcome. But as soon as we understand those, I think we have to learn on the ground, and we have to be able to process our failures and make sure that we scale up based on our experiences. So I think the first few weeks will be testing and will be challenging, but we have to obviously learn from what we do and make sure that we go to scale as rapidly as possible. I think the best parts of the program will be these large programs, big scale, where you can try and process 10,000 people a day. And that's going to be our biggest bang for our buck, is to try and get high volume through programs at big centres.
Do we know when the next batch would be expected? I think in the majority now, the concern is the third wave. South Africa concerned, of course, as we head towards winter, when immune systems are low, some people are getting the flu. Do we know when this next batch is expected in South Africa?
Well, I think in the month of May, a lot will happen. And so we will see both the J&J and Pfizer program.
Any indication, Prof, perhaps mid-May. When?
So, so I think that we're looking at hopefully the first and second week of May. And, as we finish Sisonke, so obviously we are finishing our program, which we need to vaccinate 200,000 people. And then there can be a transition onto the other programs. So we're hoping that towards the first and the beginning of the second week of May, the big rollout, which will mop up the healthcare workers and start with the over 60s, can occur at the same time.
What guarantees, I guess, can be given to South Africans, Prof, in light of the fact that we've had quite a number of stop and starts with regard to our vaccination program, many calling into question the credibility of our process, in that is there assurance that this time the country is ready to go ahead full steam in light of the fact that there's a concern over the third wave and that South Africa needs to get going with its program?
So there are global shortages of vaccines, and our country has faced the whole challenge of trying to make sure that they get vaccines in the middle of European Union and the US struggling to get vaccines. And so I do believe that the vaccines will start to flow in May. And there will be at a global level. I'm sure if you look at a global level, there are constraints until July. And then after July, the vaccines will flow at a global level. So we've heard about lots of manufacturers having huge problems with bringing their vaccines up to scale. And not only in South Africa, but there's even talk of suing AstraZeneca in the European Union for not delivering on the vaccine. So there is the vaccine supply is, the demand outstrips the supply. So we have to understand that at a global level, people are struggling to get vaccines, and that there will be a bottleneck for a couple of weeks, and then after that, the vaccine.
But what should we be doing, Professor? Yeah, what should we be doing then with that bottleneck?
We know what we need to do.
I don't think South Africa can afford any other delay in this process now. Yeah.
Well, we know what we need to do. We need to make sure we wear our masks, we wash our hands, and we keep our social distance, and make sure that we make sure that there is ventilation in winter. So we know what to do. So the citizens in this country need to play their part, and they need to make sure that they can protect and prevent the onward transmission of COVID-19 like we've done for the last year. And we have to make sure that we support the rollout by making sure that we're there to be vaccinated, and that there's no vaccine hesitancy. So I think it's an important part. The government in the next couple of weeks will begin to roll out, and we'll test some of the issues and the challenges. And hopefully by the end of May and June, beginning of June, we'll understand what the bottlenecks are, and that the country, both in a public-private partnership, will begin to scale up vaccine delivery. And I do believe that by mid-June, the country will be able to start going to scale, and will start being able to roll out the vaccine from about the first to middle of second week of May.
Professor Glenda Gray, thank you very much indeed for your time. The President of the South African Medical Research Council. Thanks for joining us on the programme.